Which brings me to my last point. I understand that people are worried. This is a disease that is new to our shores, although it is something that has cropped up periodically in other countries because of the virulence of the disease and the way it's transmitted and the symptoms that occur. I understand that people are scared. But what I want to emphasize once again is that right now we've got one individual who came in with the disease. We have 2 nurses who have been diagnosed with the disease as a consequence of, in some fashion, being exposed during treatment. And what remains true is that this is not an airborne disease. It is not easy to catch. You can only catch it through being in contact with the bodily fluids of an individual who not only has the disease but also is showing symptoms of the disease. And so it's important, I think, for all of us to keep perspective in terms of how we handle this. We are taking this very seriously at the highest levels, starting with me. And my entire team has been essentially deputized to work with Health and Human Services and CDC. And that includes, by the way, the Department of Defense and our national security teams. We understand why it's important for us to provide assurances to the public that folks are taking this very seriously, and they are. And obviously, because of the 2 nurses getting sick, that has made people that much more concerned. So all that's understood. But I do want everybody to understand it remains a very difficult disease to catch. And if we continue to take the steps that we need to, then this will be contained. The main thing that everybody needs to focus on is that the risks involved remain relatively low, extremely low, for ordinary folks. The biggest thing we have to do is make sure that health workers have more confidence, because they are on the front lines, and we're entering into flu season, which means that there are a lot of people who may be coming in with symptoms, and there may be false alarms and concerns. And so we're going to spend a lot of time working with our public health workers to make sure that they feel safe and adequately protected. But I want to assure the American people, we're taking this seriously, but this is something that's really hard to catch. And if we do what we need to do, and we stay focused, then this is going to be something that is contained here. The work that we have to do overseas is going to be a lot tougher, because frankly, they don't have a public health infrastructure, they're not well organized, they're poor countries, and the epidemic is already raging there. So that's going to take several months for us to be able to start seeing the kinds of progress that we need to see. But in the meantime, I want everybody to know that everybody here is on the case. All right? Thank you very much, everybody.